Hey guys, Dr. Bergmann here at Rosemary Jones Chiropractic. This week's video we're going to be talking about the Graston technique. Now Graston is a soft tissue technique, or something that we use for muscles and ligaments when there's a problem with them. So a way that you can get muscle adhesions in your body is if you either there's dysfunctional movement, or if you use the muscle so much that it becomes hypoxic or it runs out of oxygen. So a lot of times we'll see, like for instance, IT band in long distance runners, or plantar fasciitis. Those are things that we can treat with the Graston technique, where we can go through and strip out some of those adhesions and get that to move better. So around every muscle there's a fascia around it. So the muscle slides in between this layer when it contracts. Well, if you use it too much, it forms adhesions where it's basically like a saran wrap around the muscle, and that saran wrap becomes adhered. So when the muscle pulls, this fascia pulls too. So it can affect muscles, nerves, vessels that are all around that. So the Graston technique is used to break up those adhesions, to try to get those muscles to move more freely and take away the pain. So a couple of the tools, we've got some of the Graston tools here. So they're metal tools, but they've got a beveled edge on them, and what we do is we can slide it along the tissue. Now when we slide that, it should be smooth, but if I can feel it, it's almost like a gravelly or bumpy feeling. That means that there's adhesions in the tissue. So we would continue to work those tissues, and it's not painful. You can just feel it kind of grinding in there with that gravelly, but it brings more blood to the surface, and it will help heal that tissue and get rid of those adhesions. So that's just something else that we have available here at our office that we can do to help treat the soft tissues. That isn't necessarily an adjustment or decompression and things like that. So it works great. Like I said, we use it a lot for IT band. We use it a lot for plantar fasciitis. Those are things that we use it most often for, but it has a lot of different uses. So I appreciate you guys watching. Again, I'm Dr. Dave Bergmann here at Rosemary Jones Chiropractic.